I think the most important take-home message for the diabetic foot, which was stated many years ago by one of my mentors, Dr. Paul Brand, who worked in leprosy. Leprosy damages peripheral nerves and leads to the same sort of end stage as we get in diabetes, loss of the gift of pain. And he was asked what's the most important thing that doctors can do in the United States to reduce amputations. And of course, being in the USA, people were expecting some new techniques of radiological or scanning. Mm-hmm. And he said the most important thing you can do to reduce amputations in diabetes is every time you see a patient with diabetes, remove the shoes and socks and look at the feet. And that's still true today, and sadly, often that does not occur. And I'll give you the ultimate example, because I always ask patients, how are your feet? And they say, thank you very much for asking, they're fine. And I said, I'd like to look at them, and this patient said, oh, they're fine. I said, well, I'd still like to look at them. He couldn't take his left shoe off because there was a nail through the shoe into the foot and he couldn't feel it. So never fail to examine the feet. Well, I gave the founding launch lecture at the setup of the American Diabetes Association Foot Council back in Indianapolis 30 years ago. And there's no doubt that much progress has been made. For example, in treatment of the neuropathic foot ulcer, which we still see a lot of in this country, especially in the southern states. The treatment of neuropathic foot ulcers, there is now solid evidence that offloading with an irremovable device from a systematic review is really excellent in healing plantar neuropathic ulcers. We've learned a lot more about the rare condition of Charcot-neuroarthropathy, although our knowledge of the pathogenesis is still fragmentary, but many pieces of the jigsaw puzzle have been filled in. In terms of foot care teams, I think it's well established now from many centres in the USA, in East and Western Europe. We're working together with this approach has been shown in many studies from different centres to lead to a reduction in amputation. Regular screening, education, regular podiatry, good foot care, and so on. So those are two advances, but there are areas where we haven't advanced. I think it's fair to say that in terms of antibiotic treatment for infections, there are no good randomized trials to advise us which antibiotics should be used. And I'm always asked that question, and I said, yet to be answered. And surprisingly, we all believe inherently that education should work to reduce foot ulcers. But there have been two meta-analysis systematic reviews that actually show that there is no evidence from randomized controlled trials that education of high-risk patients actually reduces ulcers. Now, I think that's not evidence of no effect. It's a statistical finding, but we still, of course, have to educate our patients. But it may be that the team, education plus regular foot care, plus podiatry, plus good footwear, all that works together, but education alone may not.